Okay, I'm going to walk you through how to do an abdominal brace in our 90-90 position. So you're going to want to lay on the ground. You can do this with either a chair at home or a couch or an ottoman, somewhere where you can comfortably put your legs up into our 90-90 position. Okay. So we're going to lay on your back. You want your knees, as best as possible, to be over the hips. And we want to make sure that we're not allowing the knees to collapse in or flail outwards. We want to try to keep them as best as possible stacked over our hip. When you lay down, we want to try to get our back as flat as we can, especially if there is an arch in the center of your back here. You're going to want to try to get that as flat as you can. For some of you, you may even need to maybe prop up your shoulders with one or two pillows to try to eliminate any arching you have in your back, because the goal is to have our pelvis and our rib cage in alignment, which you cannot do if you have an excessive arch in your back. So in this position, what you're going to do is first start off by establishing your breath. Take a nice inhale in, just feel the body expansion and how you're breathing into your back in this position. You may have been asked to also turn your hamstrings on, where we're going to just gently engage the hamstring so that you can feel that you're pulling your sit bone up towards the knee. Your low back flattens a little bit more. When you engage the hamstring that way, you should feel that it's a little bit easier to take that breath and have it expand into your body compared to when you had the hamstrings off. This will also help your core engage itself a little bit better. So if you remember, what we want to make sure of is we're going to create some tension in our abdominals. So we're trying to activate our transverse abdominis. And so what I would like for you to do is you're going to make sure that you keep your upper abs and the muscles around the belly button relaxed. And as you exhale, I want you to feel those lower abdominal muscles wrapping themselves around your body, pulling in, creating a little bit of tension. And you almost want to feel like there's a zipper, like you're zipping a jacket up, and there is a flattening or a hollowing of the lower abdominals as you're exhaling. The hip bones may sink down and pull inwards a little bit. If you place your hands on the side of your lower abdominals, you may even feel the muscles tensing as you exhale. And you're going to draw the abdomen towards your spine. Belly button stays relaxed. Once you get used to performing the abdominal brace while you're exhaling, and the slower you exhale, the longer you can hold and maintain that brace. What you want to work towards is exhaling to initiate the brace, feeling the belly hollow down, belly button stays relaxed. And then once you finish your exhale, you're going to hold that abdominal brace. It's going to feel like a corset around your belly. And you're going to try to take like a nice breath into the brace. So we want the abdominal brace and that abdominal contraction to feel firm. And it's going to feel a little bit harder to breathe, and that's normal because you've created a natural corset around your belly. But we still want to make sure that we're trying to breathe into our body as best as we can. Initially, what you'll feel like you want to do is you're going to perform the brace, and then you're going to feel like you can't take as deep of a breath. And then it may become very shallow and stuck in your chest. But I encourage you to try to draw that breath down into the body while holding the brace, because we want the abdominal muscles, your core, to feel that pressure change with your breath. And that's how we're going to develop a strong core. So that's going to be our brace in our 90-90 position. Working our way up to what I call breathing while bracing. Okay. Have a great day.